Continuing our coverage on opioids and substance abuse, the U.S. had a grim 2020 across the board in this category.
Noah Kaplan joins us now to tell us more about what's caused the drug crisis to escalate and what solutions to look at going forward.
Well, we spoke with a Mayo Clinic specialist and the manager of a health clinic in Rochester. Both tell me this time last year was especially hard, and advised transparency and diligence as two ways of solving this ongoing crisis. A stunning report. According to provisional data by the CDC, approximately 93,000 Americans lost their lives to overdose deaths in 2020, a 30% increase year over year. Some experts worry about illegally sold drugs being laced with lethal substances.
But unfortunately, all of the drugs are being tainted with fentanyl, which is an ultra-potent opioid.
When they're really struggling and try to get that easy access to those substances, they're really trying to find it wherever they can, and that increases the risk that it might be laced with something else.
People are getting more and more potent drugs. They're not aware they're getting the fentanyl typically in the supply that they're getting. They don't know how to dose it.
Another contributing factor, the pandemic, which led to unprecedented social isolation and shut down non-essential medical services.
We also closed our medical practices essentially, except to emergency care. And so people who had been receiving or needed to receive substance, treatment for addiction were unable to receive it.
Making mental health a large obstacle for substance abuse.
Mental health and substance use really coincide with one another.
As for solutions, educating the public and staying on top of those struggling. Cans, who directs the substance use area of a health clinic, refers to the latter as a smooth handoff.
Educating the public, which involves both providers and, clinics and hospitals doing that, but also just how we talk about opioids.
Transitioning, from one facility to another so we don't lose them. We don't want to lose them in the cracks, or we don't want to lose them, with days gone by, try to have to relocate and run the risk of having them relapse.
And Gazelka also mentioned how, when used properly, opioids are important medicines for a variety of treatments. However, they must stay in the hands of trained professionals. As a result, she and other professionals handling these substances are diligent when it comes to prescribing and using them. Back to you.